My case is a 46-year-old woman, Denise, had herniations at L3, L4. She had had debilitating pain for about 10 years and was told that she wasn't a surgical option because she had so much going on and no one wanted to fuse her spine when she was, in her 40s, fuse L3 to S1. So she kind of had lost all hope, and then she got great results here.
This is the Back Doctors Podcast, enlightening conversations with doctors from around the world, sharing patient stories and treatment strategies to reduce pain and increase quality of life for those suffering with spine-related conditions. You'll hear their struggles and successes as they inform, educate, and offer hope for the millions of people who have back pain. And now, here's your host, Dr. Michael Johnson.
Welcome to the Back Doctors Podcast. Our spine specialist today is Dr. Benjamin Fonke. Welcome to the podcast, Dr. Fonke.
Thank you, Dr. Johnson. Thank you for having me.
Well, we were discussing before we got on the podcast that you have a difficult case that you're going to explain to us. Or, it's these cases. I know you see these all the time. The 1 in 4 patients that is really the chronic, severe patient that is just difficult to fix or difficult to get any kind of relief with. And I know our listeners are going to be interested to hear this story. So if you want to go ahead and start.
Yes, sir. Thank you. The patient that I'm going to talk about today is Denise. And Denise came into my office last July with chronic back pain and sciatica looking for help. She was 49 at the time and is the mother of 3 beautiful girls in college and high school. She owns and runs a small business with her husband. She was referred to me by a massage therapist who is a big believer in Cox technique and regularly sends me some of her more challenging cases. I'd like to note that this massage therapist has 35 years of experience and has been part of the massage team at both Athens and London Olympic Games, and her respect means a great deal to me. And Denise was kind enough to type up a detailed testimonial, and I was going to share that with you all right now. So here's what she said. My back issue started in 7th grade when I was walking into middle school on a snowy morning and slipped going from the entry rug to the tile. I fell smack dab on my tailbone and was knocked out. It was such a hard fall that I feared I was paralyzed when I came to because I literally could not move. I was sent to the hospital, but the x-rays did not show anything. They told my mom to give me Tylenol, ice it, and sit on pillows until it healed. I remember it hurting any time I bent forward or sat down for months afterward. I eventually participated in middle school sports, but when I played volleyball in high school, I started experiencing low back pain and quit the following season. Intermittent sports in college seemed to be without consequence. Fast forward to my second pregnancy, I was 7 months along when I was 32. I fell again on my tailbone as I walked down a slight hill in the morning dew on grass wearing sandals. I fell hard enough that I went to the doctor that afternoon to check to see if my baby was okay. Everything seemed fine and I ached for a few days. It wasn't until the week after delivery that I felt the most acute pain ever when I put this 8.5-pound newborn with the weight of the carrier into the car seat. And reaching away from my body with the weight while lifting was awful, and that was the exact motion I executed. I started seeing a chiropractor regularly about 4 years after that when the pain even got worse. My chiropractor had a sign on the door that read, "Crawl In's Welcome," and believe me, there were some days where that was true for me. Chiropractic visits were helpful, but I always felt like they were just a Band-Aid. I moved to North Carolina in 2010, and shortly after I had one of the worst issues ever with my back. I sought the help of a new chiropractor who suggested an MRI. The MRI showed many issues. I went to multiple back doctors, but I was not satisfied with the option of fusing my lower back and losing my mobility in my early 40s. I decided to go to Duke University Hospital and consult with Dr. Isaacs, who ultimately said that I am not a candidate for back surgery because there are too many issues that cannot all be fixed without future problems. After 3 years and a second MRI, he basically told me to protect my back, do yoga, swim, get chiropractic visits, ice, and medicate when needed. This was a horrible prognosis at such a young age with severe pain. In the summer of 2017, I was struggling to get out of bed and I needed assistance. I was experiencing severe pain around my tailbone and sciatica that was agonizing. During my visit to a massage therapist, she recommended that I see Dr. Fonke and consider decompression therapy. I had heard of decompression because my regular chiropractor offered it, but it was very expensive, not covered by insurance, and was automated. I was also very afraid of having my back stretched because I was in pain, even though I always felt like an accordion that needed to open up. I was immobile and desperate to feel better, so I made an appointment. Dr. Fonke carefully reviewed my MRI and reports and felt that he could really help. What truly helped with the decision was to try this therapy was his honesty from the beginning. He said if he didn't think he could help, he would tell me. Luckily, he felt confident that he could make a difference, and I started the therapy or the treatment in July. He was very careful with me and told me everything he was going to do beforehand. My first impression of Denise was when I first met her last year, was a woman with a lot of positive energy, very happy, fun-loving person, but I could tell she was in a lot of pain, and she had been for a long time, and I could tell that it was interfering with her being this fun, happy person that I knew she was. It was interfering with that, and I knew that was very stressful for her. I looked at her MRIs, and what her MRIs showed, her most recent one was in 2014 when she was 46. It showed that she had a herniated disc at L3 and L4. And a herniated disc basically is a ruptured disc. It means that the hard outer fibers have actually ruptured and the inner gel-like material is starting to push its way back towards the nerves. It can be a very painful condition. And at L5, she had bilateral pars defects with severe disc degeneration. What that basically means is that the bottom bone in her spine, L5, was not fully fused together with the rest of the bone. It didn't fuse properly, maybe when she was growing up, and that bone was starting to slip forward. So she had a congenital defect that was adding to her issues. Basically, in a nutshell, she had 3 levels of her spine and her lower back that all had major issues and could be considered surgical in nature. When I performed an exam on her, the exam findings were consistent with lumbar disc herniation and sciatica pain down the back of her thigh and calf muscle. She also had a ton of restricted mobility and a lot of muscle tension. After the consult and exam, I was confident that I knew what the problem was. I had the MRI and I had her history, so I felt pretty confident I knew what the issue was and how I was going to treat it. I recommended that we start off care at 3 times a week and that we reduce the frequency as she improves. My ultimate goal for Denise was to reduce her pain as much as possible and improve her mobility as much as possible and accomplish both of these within 3 to 6 months. We started treatment a few days later, and I used what's known as Cox Technique Protocol 1. It's what we use on patients that have severe back pain that is causing sciatica pain down their legs. Those are more complex issues and require a little bit more delicate approach when we're treating those. So Cox Technique Protocol 1 is where I move the lower part of the Cox table down very slowly and up slowly. And when I do this, I'm placing the lower back into a very comfortable flexed position with a rhythmic pumping-like action. And these movements are great at reducing disc pressure and relieving nerve pain. And I would always finish each treatment with her by placing interferential current or muscle stimulation across her lower back with an ice pack right across the top of it. So that's how I treated her. And I'm going to continue with what she said in the final part of her testimony here. She said, "It feels worlds better. The sciatica finally subsided and I feel stronger and more stable than ever. I still protect my back as much as possible by tightening my abs when moving in any direction, and I also swim multiple times a week and rest when I need to. Although I am feeling much better, I do not want to take it for granted and stop the therapy. I plan to keep regular appointments to maintain the progress I have made." She's down now to where I'm seeing her about every 10 to 12 days, and we're continuing to stretch those out as we can. But considering where she was when she started and how long this has been an issue for her, I would consider this an excellent outcome for Denise.
Yeah, great story. To have those 2 disc herniations, well, 3 bad discs, the 2 disc herniations on top of a degenerative disc, along with the congenital defect and a lifetime of pain, you've really given her some hope and really have changed her life. And it sounds like she's taking responsibility in her care as well, realizing that she has to exercise and try to keep her back strong, along with continuing with your Cox technique treatments as well.
Yes, sir.
Well, great story. Thank you so much for sharing that with us, Dr. Fonke. Could you go ahead and tell us a little bit about yourself?
Well, I've been a chiropractor for about 7 years, and I come from a family of 8 chiropractors. I've been around chiropractic most of my life, both my parents, my 2 younger brothers, 2 of my uncles, and I have a sister-in-law who's a chiropractor. So I've been around it most of my life. I'm the only chiropractor though in my family that chose to specialize in Cox technique. The reason I did that is there's a few reasons why, and I wanted to kind of share those with you because I feel like chiropractic school teaches us how to be great diagnosticians and patient educators and how to treat simple cases of back pain, neck pain, headaches, muscle pain, etc., the kind of things that we see all the time. But when it comes to severe disc herniation, sciatica, and chronic debilitating pain, I feel like when we graduate school, we are left extremely unprepared. And that's why I was so thankful to find Dr. Cox and Cox Technique, because I thank him for the high levels of confidence that I have in helping these patients that you mentioned earlier, these 1 out of 4 back pain patients who make up 85% of the monetary cost as well as 85% of the pain and suffering cost of lower back pain. I became Cox Technique certified 4 years ago. One of the best professional decisions I have ever made. And I invested last year in the Cox 8 table and have been using that, and my results are getting better each and every day. I practice in Cary, North Carolina, which is a suburb just outside of Raleigh, in North Carolina.
And can you give our listeners some contact information as far as your website, email, telephone number?
Absolutely. My phone number is 919-234-1809. My website is fonkechiropractic.com, and that's Fonke, F as in Frank, Onke. And my email is drfonke@gmail.com.
And you're also on Facebook as well?
I'm on Facebook. Yeah, if you just search Fonke Chiropractic and Decompression Center, you can find me on Facebook.
Well, great. For our listeners, we'll have all of Dr. Fonke's contact information in the show notes. I did want to point out to our listeners that on your website, you do demonstrate the Cox technique so that they can actually see what the technique is like, and you can see how gentle it is, and it just gets these incredible results like you had with Denise. So, Dr. Fonke, I just wanted to thank you so much for being on the Back Doctors podcast and taking time out of your busy practice to be with us today.
That was my pleasure.
Now that you have heard this patient's success story, head on over to the backdoctorspodcast.com to connect with doctors from around the globe who want to help you find a solution for your back pain. Sign up for our newsletter to get the latest news and resources for treating spinal conditions. Thanks for listening, and we'll see you next time on the Back Doctors Podcast.
Thank you for listening to this episode of the Back Doctors Podcast. I would encourage you, if you have a particular spinal condition that you're interested in, to go back to some of our other shows and find a topic that interests you, and maybe you can hear from another spine specialist. Another way to connect with the doctors that I've interviewed is to go to our website, which is thebackdoctorspodcast.com. You can see photos, you can see images of MRIs, and you can learn more about the doctors that have been on the Back Doctors podcast. I also wanted to say thank you to those of you who have rated us on iTunes. Currently, we have a 5-star rating. We need more of those 5-star ratings, however, to reach more people, to help more people, to again, bring hope to the millions of people who are suffering with spine-related conditions. So if you would be so kind as to, on iTunes, basically all you do is scroll down to the bottom and you can see the reviews, and then there's a tab that says write a review. And if you would write a review for us, I would greatly appreciate it. You can also connect with us through Facebook. And if you have a story to share from a spine specialist that you've seen, I'd be happy to share that story on our podcast. You can contact me again through the backdoctorspodcast.com website. Again, I'm Dr. Michael Johnson. Thanks for listening.